One of the things we discuss in the travel clinic is malaria. And malaria is a word that's familiar to everybody, but most people really don't know what it is. Malaria is a very serious illness that's caused by a parasite that's transmitted by mosquitoes. Now, the mosquitoes that transmit malaria bite from dusk to dawn, so essentially during the daytime hours, there's no risk of malaria, but as the sun sets and through the nighttime until the morning, the mosquitoes bite and potentially can transmit malaria. So what you need to know as a traveler is, are you going to an area where malaria is a risk? Now, this is different from, are you going to a country where malaria is a risk? Because many countries have malaria, but only in certain parts of the country. So it's important to seek out information that gives you itinerary-specific information on malaria. What could you do to prevent malaria? Well, the first thing is you need to prevent yourself from getting bitten by mosquitoes. Now, that's may not be as easy as it sounds, but we use what's called barrier protection insect repellents on skin. And remember, when you use an insect repellent, especially if you're in a sunny climate and you're using sunblock, the repellent goes on top of the sunblock because you need the vapors and the fumes from the repellent to actually repel the mosquito. And then sometimes we'll use something called permethrin on clothing, which is an insecticide that actually has a knockdown effect for mosquitoes that land on your clothing. The highest risk areas for malaria are parts of sub-Saharan Africa, South America, parts of Central America, parts of the Pacific. But it's important to know whether your itinerary holds a risk for malaria, because it's important to take these preventive measures. So in addition to barrier protection, there are medications that are recommended that you take usually each day you're there and then for a few days after you leave. And the combination of the insect repellents and the malaria medications are usually pretty effective at preventing malaria. Most important though, whether or not you take the malaria medication and use insect repellents, if you come back from an area where there is a known risk of malaria and you develop a fever, always tell your healthcare provider, please check for malaria. That's one of the most important lessons to be learned in this country. People returning from malaria risk areas with fevers are often diagnosed with malaria an average of 7 days after they first seek medical attention. Part of this is because most physicians in this country are not familiar with malaria. So it's important as a traveler to mention to your healthcare provider, if you need to seek emergency attention, that you were in a malaria risk area.